Hi,
Thank
Angela.
Hi, thank you for joining us today. I was really excited to talk to you today about the Astra study because we've had a number of inquiries from patients across the country wanting a little more information about the study, what the treatment is, and how is it different from other alpha-1 clinical trials.
So the medication, like with most of our clinical trials, it's an investigational medication. So it's not commercially available. It's not available by a prescription here in Canada. The medication is called alvelestat. We are looking at two different doses, as well as a placebo arm. Um, the medication works by blocking certain proteins that are responsible for inflammation and damage to the lungs. So it's very different than our current treatment for alpha-1 prolastin. Prolastin is what we call an augmentation therapy. So it's boosting up the individual's alpha-1 levels. It's given once a week. This medication is looking at the blocking, like I said, those certain proteins that can damage, cause inflammation and damage to the lungs. Um, this medication is actually given orally. It's taken twice a day.
Great.
I think, did I answer?
Yeah, so who can participate in the trial? You have to be an alpha-1
So
patient, obviously.
you have to have alpha-1. Anybody between the ages of 18 to 75. Like most clinical trials, there is an extensive what we call inclusion and exclusion criteria. So in other words, you need to meet all the inclusion criteria and not meet any of the exclusion criteria to be eligible for the trial. So just I could give you just like a Cole's Notes version of what what you need, but 18 to 75, a genotype ZZ null or any other rare, with the exception of there's no MZs, FF or SZs. We also are looking at people with their spirometry, their pulmonary function tests, an FEV1 20% or greater. They need to have a past CT with evidence of emphysema, so evidence of COPD, non-smokers, and no liver fibrosis. As well, they can't be currently taking augmentation therapy. And if they were on augmentation therapy, they have to be off for at least 6 months before they can participate in the trial. A couple of the screening procedures that we would do, I talked about no liver fibrosis. Some people may not know if they have liver fibrosis or not, but we can do a special test that's called a fiber scan. Maybe some alphas have had that. It's a non-invasive test. It's almost similar to an ultrasound, and it can measure the level of fibrosis in the liver. It almost, in the past, the only way we used to see that was through a liver biopsy. So it's a great alternative. The other thing is that if you haven't had a CT scan, we can always arrange that with screening procedures.
Okay. So what are the benefits to alpha patients if they decide to participate in this trial?
So like I always say with clinical trials, and most of the clinical trials we have are double blind, they're placebo controlled, meaning that you have a chance of being on a placebo arm of it. So we can't promise that the medication will benefit you directly, but involvement in clinical trials, it generally people enjoy it because they learn more about their condition. They learn more about different options. They have the ability to have more frequent visits by a healthcare professional. They would see generally during the trial, you see the medical doctor, the doctor that's providing participating in the trial, you would see them. It also helps a lot of people like the fact that it's looking at alternative therapies that may be available to this population. And because it's a genetic disorder, it's looking into the future, and it's looking into the future, patients that may have alpha 1.
How long does this particular study last? Is it a long
So the
term?
study, it's not a long trial. We have some trials that are quite long in length. We have some that are 3 years, 5 years, 2 years. This one is relatively short. It's actually a phase 2 trial, and a lot of the times phase 2 trials are shorter because they're looking at the medication, but they're maybe looking at a couple of doses to see which one might be the most effective. So this trial is 5 months. It's broken up into, if you want to say, 3 parts. The first part would be a screening visit, and the screening visit generally comes in, and that's where I talk about the inclusion and exclusion criteria. There's a number of blood work, there might be some tests that we would do, and generally that screening period lasts up to about 28 days, so about a month. The treatment itself is for 3 months, so you're actually taking the medication for a period of 3 months. And then after you finish at the end of the 3 months, or if you were to finish the medication early for whatever reason, there's a follow-up period of 1 month. So a total of 5 months.
So the treatment is an oral medication. Do patients have to come to the clinic to take it, or can they take it at home?
So there are generally with any clinical trial, your first dose of medication is always taken at the site, so in the office. This medication, like I said, it is taken orally. It's taken every day, twice a day. There's actually 8 caplets. It's set up in a very interesting, almost like a wallet card book, and it's in a perforated, it's already set up. It has an area where to take your morning, there's usually a sun, and then there's a moon for your evening dose. In most phase 2 trials, when they're looking at different dosing and things like that, it's important to take the medication as prescribed. So they want you to take it as close to the 12 hours apart. It should be taken with food, or sorry, I shouldn't say that. It should be taken with water, a full glass of water. They recommend it to be taken with food, but it's not mandatory.
Okay. So obviously, there are a lot of concerns within the patient community about going to clinic visits, be it in a physician's office or in a hospital setting due to COVID. Are there precautions in place to reduce COVID-19 risks? And that being said, many hospitals across the country are not allowing support people to attend appointments with patients. Do you know if it remains an issue?
I can't speak for all institutes, but for us, we do allow a support person to come in.
Okay.
So we allow for it. Our office is, like most offices, working at a reduced patient capacity. So we don't have as many people sitting in our waiting room. We don't have as many people in. Our office where this particular study is working out of is a medical building, and you can't come into our building without having an appointment. So you can't just walk in, you have to have an appointment. They do a screening, fairly intensive screening of the COVID symptoms. They also do a temperature check. Anybody walking through the doors of our building must wear a mask, and that mask stays on the entire time. Just like the staff here, we all wear masks. With the exception, if there is any spirometry or pulmonary function testing done, that's the only time that the mask would come off, and the technician or the coordinator that would be performing the test would have some added safety precautions. So in my experience from our building here, as well as our hospital here in Toronto, it has become, I want to say, more difficult to come in as opposed to just people walking in. It is safe. Generally, what we do is we tell patients or study participants, if they're if they're coming in, we'll call them beforehand, make sure they haven't experienced any kind of the common symptoms of COVID-19. They've not been around anybody that's been positive. They haven't traveled outside of the country. They haven't done any of the travel restrictions, and encourage them to let us know that even though they might have waited a couple of weeks for this appointment, if they do develop the symptoms, please stay home. We can always reschedule.
Okay. So if an alpha patient does meet the criteria,
Yes.
And is successful during the screening process, will they have to make any changes to their diet or lifestyle as they move forward with the trial?
So this particular study doesn't require any food restrictions. There are no food restrictions. They do strongly suggest to avoid any alcohol intake while taking the therapy.
Okay.
I think I maybe not completed one of your questions about taking the medication and if you have to take it here. Like I said, some doses you would have to take here on site,
Okay.
but the medication, we would send you home with a certain supply that you would take until your next visit
Okay.
is scheduled. So you would take the majority of the medication, you would be able to take it home, but certain visits require you to take the medication on site. Sometimes we need to do some tests just prior to you taking the medication.
Jane, are patients compensated to participate in the trial at all?
So we do reimburse for out-of-pocket expenses, like for instance, parking. If you have to travel a fair distance into the site, we can look at mileage reimbursement. We do provide a compensation, or I should say reimbursement for meals. In some cases, sometimes visits can be quite lengthy. So we want to make sure that you are compensated for any meals. In some cases, we do have some participants that may not live within our greater Toronto area. We may even have some patients that are interested that are from out of province. We usually look at these as a case-by-case basis, and it's one of those things that you would talk with the sponsor about, and it's not unheard of us arranging airfare, hotel accommodations, even rental cars, things like that.
Okay, excellent. Um, I think we've provided a pretty good overview of the Astraeus study. I will be including the Astraeus study link at the end of this little video if patients want to get more information. And of course, we'll provide contact information for all of the sites if patients wanted to follow up, and encourage them to contact yourself, any of the other research coordinators, or even Alpha One Canada if they wanted to learn more about this trial and to see if they're a candidate for it. So thank you for your time today, Jane.
Thank you.